Hello everybody, Spirited Senior here, just bringing you some more news. This is from Donald Trump himself, I guess. Donald Trump, illegal migrants cost Americans 300 billion each year. 300 billion. Unbelievably. The tweet comes as a growing number of Democrat legislators and 2020 candidates step up demands for taxpayers to provide more health care to illegal immigrants. Illegal immigrants cost the U.S. over $300 billion a year. There is no reason for this, and things are being set in motion to have this number come way down. Democrats could end loopholes and it would be a whole lot easier and faster, but it will all happen anyways. That's from Donald's tweet. The slam comes after Donald knocked the Democrats' 2020 candidates in June for promising to provide illegals with American health care. I remember that one. All Democrats just raised their hands for giving millions of illegal aliens unlimited health care. How about taking care of American citizens first? That's the end of that race, Trump said. Breitbart News reported in June that most of the prominent 2020 Democrat presidential candidates said that illegal immigrants should have access to free health care either under Medicare for All, a public option, or other government health programs. 11 of the 2020 Democrat presidential candidates backed free health care for illegal immigrants, either under Medicare for All, while 8 Democrats, including frontrunner Joe Biden, ducked the question. Joe Biden is also slamming Trump for his deputy's August policy of withdrawing special health care visas from critically ill migrants. Well, they shouldn't have had them in the first place. They're literally giving notice to these families that they've got to unplug their kids and get them out of hospitals and take them out of America. When has that ever happened in the United States? We're 300 million plus people, and the idea that we can't tolerate saving the lives or trying to save the lives of hundreds of children in deep need is just wrong. It's just wrong. It has to stop. Like so many others have said, cruelty is the point here. It's their only point. It all has to run on fear, anger, division, cruelty. So this can't just be a presidential campaign about Donald Trump. It has to become a movement. Well, you know what, Joe Biden? I think you're pretty dumb. Joe Biden says Trump's deputies are forcing parents to unplug their kids from hospital beds. Actually, USCIS is drawing painful lines on medical tourism by distraught and dissent foreign parents whose numbers will rise to exceed any plausible generosity. No kidding. Biden criticism forced a quick but partial retreat by Trump's deputies. In turn, House Democrats held a hearing on September 11th to criticize the Trump administration program to revamp the award of roughly 500 health care visas per year. This really is a mortal crisis, said Maryland Rep. Jamie Raskin, chairman of the Oversight Committee, Reform Committee on Civil Rights and Civil Liberties. A lot of us felt great pride that America could play its role for sick kids from around the world, the Democrat said. Well, you know, these guys, they just spew shit, don't they? House Speaker Nancy Pelosi touted the political push. Maria Isabel Bueso's story inspires countless Americans to speak out for immigrants like herself who benefit from medically deferred action, a humanitarian initiative that is literally life-saving. It was my pleasure to welcome her to the U.S. Capitol today. Really. It was your pleasure, but not the rest of our pleasure, was it? The Democrats' Senate leader, Senate Chuck Schumer, also urged the award of health care visas to illegals. Senate Chuck Schumer urges DHS to not deport the growing number of illegals who rely on life-saving U.S. care. Okay, but he could lead by drafting a 2020 law to efficiently allocate U.S. healthcare money among Americans and the limitless supply of foreign patients. Does anybody ever think who's paying for this? You're making us poor, paying for them. Isn't that great? Public attitude on this issue, is like most Americans, including swing voters, want to welcome legal immigrants and do not wish to be hostile to migrants, even to illegal migrants. But opinions change once people are asked to balance their differing obligations to illegals and to Americans. For example, data buried in the August 2019 Harvard-Harris poll shows little public support for aid to illegals. Only 30% of Democrats and 20% of swing voting independents agree that immigrants who are here illegal should be able to collect welfare, disability, health care payments from the state and federal government. Oh, God. The deferred action policy has also foreigners to fly into the U.S. to get free medical care for many years, as a potentially huge cost to Americans. The New York Times provided 2 examples of foreigners who came to America for health care 9 and 4 years ago. I'm not going to get into that. I'm just going to keep going. Trump's estimate of the cost of illegal immigrants are higher than other estimates, but may include both government spending and the huge indirect costs of cheap labor migration that is imposed on American workers. And that's another thing, too. Yes. The marketplace costs many exceed government spending costs. For example, the National Academies of Sciences reported in 2016 that legal and illegal immigrants flood the labor market and drive down the wages by roughly $500 billion per year. Oh, they're not harmful, are they? The immigration tax is described as the NSA report, which also says that nearly all of the lost wages are transferred up to America and foreign employers and Wall Street investors. Oh, there you go. Illegal immigrants, as well as legal immigrants, also is a huge cost to federal, state, and local governments. In 2017, the Federation for American Immigrants Reform reported that 12.5 million illegal immigrants boosted federal spending by roughly $116 billion in 2017. 116 billion people. That estimate includes 17 plus 1 billion in federal health care spending for illegals. God. Legal immigrants, as well as temporary visitors, also can get federal health care funding. For example, new legal immigrants get special subsidies for joining Obamacare, according to a health care insurance website. Wow. In 2016, the Forbes article estimated that almost 4 million illegal lack health care insurance, that they impose an $18.5 billion health care cost to Americans. Nobody thinks about that, eh? Well, who cares about you guys, you know? Those budget calculations, however, did not include the cost of illegal migrants' U.S.-born children. The federal health care spending is augmented by state spending on health care for illegals and special programs to help illegals. They should have special programs to help our own people. The resident population of legal and illegal migrants costs state and local governments roughly $57 billion per year. That's on top of the other money the National Academies of Science reported in 2016. Wow, 6 states and the District of Columbia have expanded their Medicaid programs to cover children through 18 years old. California recently approved coverage through age 25. They're not children when they're 25. They stop being children at 18, the minute they can go off to war, regardless of immigration status, the New York Times reported on July 3rd. The report declined to estimate the cost Americans are paying for these migrants, but continued. In 2016, the Wall Street Journal reported that 20 countries and cities also provided health care to illegals. Wow. These people are costing a lot of people a lot of money. Like, where is all this money supposed to come from, eh? Like, nobody's thinking about that at all, I guess. It's unfortunate. Well, that's it for that. Just wanted to keep you informed on how much all of this is costing everybody. I mean, it's no wonder, I don't know how Trump's doing it with cutting taxes and everything, but I know he's going to figure out a way, and most of these people aren't going to be able to get in anymore. If they want something so badly, let them stay in their own country and fight their government for it. That's what I think. We do that here. Let them do that there in their own country. Thank you for listening, everybody.